Hi. Hello. Welcome to the preview for Beyond the Clinic, presented by ACOOG, the American College of Osteopathic Obstetricians and Gynecologists. I'm Brandi Koskie, and I'm so thrilled to have Dr. Emmie Strassberg with me today, a longtime ACOOG member and fellow, and the program chair for this Saturday's Beyond the Clinic. Welcome, Dr. Strassberg.
Hello,
we know this
thanks
sense of sorry. We're dodging background noise on Dr. Strassberg's end. So so as we get started here. So we know this sense of feeling stuck or burnout is really common really for any, professional, any career, but it's especially true for physicians. And there's some, new data out this year that's showing that the burnout rate for physicians is trending down at about 45%, reporting feelings of burnout this year. But that's still a lot of people who are going to work and just not feeling it. And OBGYNs feel this more than most. The AMA has cited that your specialty, OBGYN, is one of the top 5 burnout rates. Can you share with us, Dr. Strassberg, a bit about your own experience and the path that your OBGYN career has taken?
Yeah, so I'm Emmie Strassberg. I'm a maternal fetal medicine physician. I live in Virginia, and I was practicing in Northern Virginia for the last 8 years. But I did leave my hospital job last summer. It just got to be to where the expectation was to do more with less in a way that really wasn't working for me. And I wanted to be able to spend more time with patients and have more autonomy over my time. There it is. Sorry, background noise.
The cats have been fed. It's all good.
It's okay. They're very happy now. And so leading up to that, so sort of this was a process for me over like 2-3 years. And leading up to that, I had spoken with my good friend and colleague, Karina Muller, who has her own private practice doing maternal fetal medicine in Alaska. And she had asked me if I would ever be interested in coming up and doing some locums coverage for her while she was on vacation. So I knew I had that I could do. And I started working with OB Telecare once I quit my other job, doing maternal fetal medicine, telemedicine from my house. And so this opened up a lot more space in my life and a lot more time for my family and time to start my own business. So I have my own practice doing preconception counseling, so pregnancy planning visits for women who have had complications in their previous pregnancies or have medical conditions or on certain medications that they need to maybe figure out if they need to get off before pregnancy. And so I see those patients in my clinic. I currently am seeing patients in Virginia, Alaska, and Florida. And I also have a membership and a support program for women who are planning to get pregnant after pregnancy loss. So that's a population that's near and dear to my heart. And we never have enough time to give as much support in the office as these patients really need. And so I started this membership as well. So that's me.
That's great.
That's what I'm doing. I am really loving it.
That's great. Thank you for sharing all of that. I know, as a person who's often in, as a patient myself, and a lot of women, we, also don't feel like you ever get quite enough time to have those conversations. So it's incredible that you've kind of made space for that and are doing so much good work for women. I'm wondering if anybody watching right now, kind of hears Dr. Strassberg's story and can relate. And feels like, oh, that sounds like me or where I am in my own career. And if so, leave a note in the comments, let us know. Also feel free to ask any questions as we have this quick conversation today. So you've taken kind of your own experience with your own career and your own perspective and kind of combined that with several of your colleagues, and you guys have created Beyond the Clinic, which is ACOOG's Summer Virtual Symposium. It's being held live this Saturday, June 13th. Can you tell us a bit more about what Beyond the Clinic is and why you and 15, which is incredible, of your colleagues wanted to organize for this truly unique CME event?
Yeah, so actually, I have to give some credit to Carla Loken, who is going to be co moderator with me, and also one of our speakers. And she's somebody that I had spoken to at a conference, I think just this last fall. And it turns out she's had many roles in all sorts of different places in medicine. And she had this group of speakers that had this particular um, program that they had presented to ACOG that was very much around alternative roles in OBGYN. And ACOG had declined it. So when I told her, I was thinking of doing something like that for ACOOG, and I had this summer symposium. We pulled it together. We pulled in some great ACOOG members as well to join us for these panels.
Mm-hmm. So there's 15 OBGYNs, 6 career pathways, and that's a lot to cover this Saturday. Can you share a preview? Can you tell us who the faculty are and what the sessions are that people can look forward to? What those 6 career paths are that aren't in an exam room with patients?
Yeah. So I'm sorry. Can you still see me if I switch to a different page here?
Mm-hmm.
Okay, good. So there are 6 different panels, and I thought it would be great to do panels instead of lectures because we're also used to being lectured at. And it's just fun to have these conversations with people that are really out there doing different things. So we're starting with storytelling and social media, and we have Carrie Krause and Fran Haydenek, who's better known as Paging Dr. Fran on social media. And they're going to talk about what it's like to build a social media platform. And they do a lot of great work advocating for the profession and evidence-based medicine and educating the public with their platform. So I'm really looking forward to that one. Andrea Braden, Dr. Andrea Braden and Dr. Barbara Hanna are going to talk about innovation and being founders in different areas of medicine. We have 3 great private practice doctors, Dr. Renujashi Sadaf Lodi and Karina Miller, who are going to talk about their private practice and some of the other things they do in addition to their private practice and how that is all built together in their career currently. We have a session on academia. So we have Anissa Madison, who's the Associate Dean at, I don't want to get this wrong. Yeah, Associate Dean at Michigan State, and Dr. Matthew Shelnut, who is Assistant Professor of Osteopathic Manipulation at Pecan, Georgia, South Georgia. And they are going to talk about what it's like to be involved in academics. And then Amy Burkett and Jody Bennett, who are women doing great advocacy work for women's health and how they do that and they incorporate that into their career. I have actually benefited greatly from Jody Bennett's mentorship in advocacy work and have really enjoyed participating in the ACOG Congressional Leadership Conference. And that's all thanks to her getting me involved in that. And then lastly, we have industry with Carla Loken, Angela Jones, and Ruta Desai, who are all involved in different areas of industry and what it's like to be a consultant for an industry.
That's great. It's such a powerhouse lineup of physicians joining this, and not a physician myself, but I'm excited to hear from all of them. And I think whether you're an OBGYN or not, any physician would really, benefit from hearing about these alternative paths. And, in some cases, these can be very complementary to clinical practice. And in
Absolutely.
others, they do open up. And are you seeing a lot of that happen even amongst the faculty or who are presenting that, they're kind of maintaining a clinical presence and then throwing on a side hustle?
I would say it's not even hustle so much as that they're also multifaceted in what they do. And it's just, I think it really helps with things like burnout to be able to have more than one role and autonomy and things like that. And often these other career pathways give you that.
Absolutely. Well, and like you said, with the multifaceted, everybody's got different talents and skills and experiences. And so to be able to, kind of manifest those and, use them in different ways, makes you feel like more of a whole person than just this one thing.
Yeah.
Who would you say Beyond the Clinic is for exactly? I know it's for, there's a discounted rate for members, for ACOOG members to participate. Students and residents are actually free so long as they've registered as with the free membership that ACOOG offers. And so, who do you think exactly Beyond the Clinic is for, and who should be going over to register for this Saturday's event right now at acoog.org?
Yeah, I think if you're a doctor who's just interested in potentially other aspects of a medicine career than clinical medicine or corporate medicine, and you're looking for, maybe a different way to find purpose or a different way to get involved, I just, for me, I loved my job so much, and it was a great 8 years at the hospital that I worked at. But it became very clear to me that I needed something that was outside of that. And so I think if you're in those shoes where you feel like something else is needed in your life, you need something new, something different, maybe something purposeful in a different way, this is a great entry point to see what's out there.
Hi. I think I dropped for a second.
Did you hear me?
I heard you say, "I love my job," and
Oh,
then
yeah, I
it
said
went
I think it's a great entry point for if you're thinking of, something else. If you need something else than your current job, it's not doing it for you. It's starting to feel like you might need an exit pathway or exit strategy, or you just feel like maybe there's something more out there that could make you feel more purposeful, or a bigger creativity outlet than you're getting, things like that.
absolutely. Well, again, you can go to acoog.org and register for Beyond the Clinic this Saturday. Um, and that is, again, there's a discounted rate for ACOOG members, and it's free to students and residents who have um, already signed up to take advantage of the complimentary membership that ACOOG has available.
I think
That is Beyond the.
also
Oh, go
important
ahead.
that if you cannot come to the live session, it will be recorded and you will be able to watch that and get credit later.
Yes, and that's an important detail. It is worth 6 CME credits, up to 6 CME credits, for the 6 sessions. Thank you so much for all the work that you have put into this, Dr. Strassberg, as well as to your colleagues who I know are working really hard to organize this behind the scenes. I think it's going to be I think it has, it will be a career changing event for a lot of people, and for them to kind of understand where their career can go from here, or for those just getting started to kind of know that
Yeah.
there are a few paths in front of you and what you can take, what you can pursue. So, thanks for the time this afternoon, Dr. Strasberg. Looking forward to see you on Saturday for Beyond the Clinic at ACOOG, and we will see you
All right.
next
Sounds
time.
good. My pleasure. Thank you so much.